Hi everyone, I'm Shoba Jayakumar, one of the nursing job exam education specialists, JESH nursing. In this video, we are going to see urinary system review, urinary tract infections, some of the concept and rational of some of the questions answers we are going to see. Let's move on the questions. The first question is, the nurse is aware that the following findings would be further evidences of a urethral injury in a male client during rectal examination. Here the answer is the second one, the presence of a bogimus. Why? The presence of a bogimus is the answer. The reason is that when the urethra is ruptured, a hematoma or collection of blood separate into two sections of urethra. This may feel look like a bogimus or on the rectal examination. Because of the rupture and hematoma, the prostate become high riding. Okay, next move on to the second question. When a female client with an indwelling urinary catheter insists on walking to the hospital lobby to visit the family members, nurse roads teach how to do this without compromising the catheter. Which client action indicates an accurate understanding of this information? The answer is B. The client keeps the drainage bag below the bladder at all time. Why we need to keep the urinary catheter below the bladder level all the times? To prevent urinary tract infections and to prevent to make continuous urinary drainage. So if the urine go back to the urinary bladder, the patient will the patient may get urinary tract infection. To avoid this urinary tract infection, no CAR-T. If you wanted to implement, we have to keep the drainage bag below the bladder level at all times. Okay, let's move to the third question. A female client has just been diagnosed with condylomata acuminata, that is genital warts. What information is appropriate to tell this client? What is the answer from all of these four answers? The A is the answer. This condition puts her at the higher risk for cervical cancer. Therefore, she should have a pap smear annually. So the general wards, what is the indication? Why this general wards happened? What is condylomata acuminata? This all we should know. What is general ward? What is the risk of that? This general wards is an indication of some of the sexually transmitted diseases. A woman with condylomata acuminata are the at a risk for cancer of the cervix and vulva. So pap smear is ideal. Early detection is prevention of cancer, and to prevent we can prevent certain conditions like cancer. The advanced stage we can prevent, and if you identify in early stage, a cure is possible. So these are the approaches we can implement in this situation. So because of condylomata acuminata is a virus, there is no permanent cure. Everyone should understand this, because condylomata acuminata can occur on the vulva, a condition won't protect sexual partners. Question number 4. A male client with bladder cancer has had the bladder removed and an ileal conduit created for urinary diversion. While changing this client's pouch, the nurse observes that the area around the stoma is red, weeping, and painful. What should nurse Katrina conclude? The answer is B. The pouch faceplate does not fit the stoma. So the pouch faceplate is not fit the stoma. Because of this, all these symptoms has been uh, happened: weeping, painful. Because these are the if the faceplate is not fit that area, what will be happen? The pouch feces does not fit the stoma properly. The skin around the stoma will be exposed to continuous urine flow from the stoma, causing excoriation and red, weeping, and painful skin. A lubricant shouldn't be used. The next question, the nurse is aware that the following laboratory values support a diagnosis of pyelonephritis. What is the answer here? What is pyelonephritis? We should know first. What is pyelonephritis? Inflammation of the pylorus region of the kidney. Pyelonephritis. Looks like it is an inflammatory condition and infection. So, what will be the answer from here? Pyelonephritis is the diagnosis of. It's diagnosed in the presence of leukocytosis, hematuria, pyuria, and bacteria. So, this is a infective conditions. The patients will be having fever, chills, flank pain. Because of this, the person will become septic. WBC, it will be more likely to be high rather than low, because this is an infection. So here the answer is pyuria, the common pyuria. Pus will be there in the urination. Leukocytosis. What is leukocytosis? It's excessive leukocytes in the blood. Next question, question number 6. A female client with chronic renal failure is receiving a hemodialysis treatment. After hemodialysis, a nurse Sarah knows that the client is most likely to experience hematuria, weight loss, increased urine output, increased blood pressure. Which will be the answer? Hematuria will be there? No. Weight loss? Maybe. Increased urine output? No. Increased blood pressure? No. Which will be the answer? Let us see. So B is the answer, weight loss. Why this weight loss is possible? Because CR of chronic renal failure causes loss of renal function. The client with a disorder retains fluid, it will be removed. Hemodialysis, the function of the hemodialysis, the action of hemodialysis is removes this fluid, causing this leads to weight loss. Next question, nurse Leah is assessing a male client diagnosed with gonorrhea. It's a sexually transmitted disease. Which symptoms most likely prompted the client to seek medical attention? Rashes on the palms of the hands, cauliflower-like warts on the penis, painful red papules, foul-smelling discharge from the penis. So, gonorrhea is a sexually transmitted disease. So, which is the most common symptoms will be there for this condition, gonorrhea? The common symptoms are gonorrhea in men include pus will be there, purulent pus, foul smelling drainage from the penis, and painful urination. Okay, next question. Nurse Agnes is reviewing the report of client's routine urine analysis. Which value should the nurse consider abnormal? A specific gravity of 1.0, urine pH 3, it's abnormal. Absence of protein normally in urine analysis should not be there. Absence of glucose also. So which will be the answer? Normal pH, urine pH is 4.5 to 8, but here it is given as 3. So abnormal answer is 3. Then urine specific gravity normal is 1.002 to 1.035. It is normal. Then urine contains no proteins and no glucose, ketones, bilirubin, bacteria. So these are normal. A male client is scheduled for a renal clearance test. Nurse Mohrin should explain that this test is done to assess the kidney's ability to remove a substance from the plasma in 1 minute, 30 minutes, 1 hour, 24 hours. Answer is in 1 minute. The renal clearance test determined the kidney's ability to remove a substance from a plasma in 1 minute. So action of the renal clearance test is to determine the kidney's ability to remove a substance from the plasma in 1 minute. Next question is, a male client in the short procedure unit is recovering from renal angiography in which a femoral puncture site was used. When providing post-procedure care, the nurse should, the answer is C. Check the client's pedal pulses frequently. Why we need to check the pedal pulses frequently? That the rationale is very important, we should know. So femoral puncture site is, for the angiography we are using the femoral puncture site. So continuously when we are assessing the pedal pulse, any abnormalities are noticed, we could find out earlier, so we can prevent some of the complications. After renal angiography involving a femoral puncture site, the nurse should check the client's pedal pulses frequently to detect reduced circulations in the feet caused by vascular injury. Next question. A female client is admitted for treatment of chronic renal failure. Nurse Juliet knows that this disorder increases the client risk of water and sodium retention secondary to severe decreases in the glomerular filtration rate. So always you should remember, chronic renal failure admitted for the treatment, water and sodium retention will be there. So because of this secondarily it leads to severe decrease in glomerular filtration rate. Next question is question number 12. Because of difficulties with the hemodialysis, peritoneal dialysis is initiated to create a female client's uremia. Which findings signals a significant problem during this procedure? Patient is difficulties with the hemodialysis. Peritoneal dialysis is initiated. So the hemodialysis cannot be done and peritoneal dialysis initiated. So we should identify what are the complications are associated with peritoneal dialysis also. So the answers here given as potassium level 3.5, which is normal. Hematocrit is 35%, which is lower than the normal level. Blood glucose level 200 mg per deciliter, which is higher. Once the patient goes to the dialysis, hemodialysis, this may increase, but insulin can be given to reduce the blood sugar level. Then white blood cells count is 20, it is abnormal, which is the answer. So an increased WBC count indicates an infection probably resulting from peritonitis. So person with peritonitis, they should not go for peritoneal dialysis. Person which may have caused by insertion of the peritoneal catheter into the peritoneal cavity. Also, peritonitis may cause the peritoneal membrane to lose its ability to filter solutes. Therefore, peritoneal dialysis would be no longer as a treatment of choice for these conditions. Hyperglycemia occurs during the peritoneal dialysis because of the high glucose contents of the dialyzer. So, these are the two reasons the person should not go for peritoneal dialysis. Next question. For a male client in the oliguric phase of acute renal failure, which nursing intervention is most important? Acute renal failure, oliguric phase. There are three phases. So in the oliguric phase of acute renal failure, which intervention is the most important intervention? During the oliguric phase of acute renal failure, urine output will be decreased and possibly it will lead to fluid overload. Limiting the oral and IV fluid intake can prevent fluid overload and we can prevent certain complications like heart failure and pulmonary edema. In this stage, we should give the interventions as encouraging coughing and deep breathing is very, very important to avoid certain respiratory disorders. Next question is, a female client requires hemodialysis. Which of the following drugs should be withheld before this procedure? Phosphate binders, insulin, antibiotic, cardiac glycosides. Cardiac glycosides we should prevent. Cardiac glycosides, it is a group of digoxin. It should be withheld before hemodialysis. Why? Hypokalemia is one of the electrolyte which is shift that occur during the dialysis, and the hypokalemic client is at risk for arrhythmias secondary to digitalis toxicity. So the cardiac glycosides like digoxin is and digitalis toxicity is the risk, so we should not give cardiac glycosides before going for the dialysis. A client comes to the outpatient department complaining of vaginal discharge, dysuria, and genital irritation, suspecting a sexually transmitted diseases. Dr. Smith orders diagnostic test of the vaginal discharge, which STD must be reported to the public health department. Which is the answer? Gonorrhea is a reported to public health department. Chlamydia, genital herpes, and human papillovirus infections are not a reportable diseases. Gonorrhea is a sexually transmitted disease, so we must report to the public health agency. Next question is, a male client with acute pyelonephritis receives a prescription for cotrimoxazole Septra per oral twice daily for 10 days. Which findings best demonstrate that the client has followed the prescribed regimen? Which is the answer? Cotrimoxazole is a sulfonamide antibiotic, which is used to the urinary tract infections. So bacteria are absent or urine culture. Therefore, the absence of bacteria on urine culture indicates that the drug has achieved its desired effect. Although flank skin may decrease as an infection resolves, this is not a reliable indicator of the drug's effectiveness. A 26-year-old female client seeks care for a possible infections. Her symptoms include burning on urination and frequent urge and voiding of small amounts of urine. She is placed on trimethoprim sulfamethoxazole to treat possible infection. Another medication is prescribed to decrease the pain and frequently. Which of the following is the most likely medication prescribed? Pyridium. What is the action of this pyridium? This phenazopyridium may be prescribed in conjunction with an antibiotic for painful bladder infections to promote comfort. So, because its local anesthetic action on the urinary mucosa, this drug is specifically relieves the bladder pain. This is the reason this medicine is prescribed for this bladder pain, to relieve the bladder continuous bladder irrigations following the transurethral resection of prostate. A triple lumen intervening urinary catheter is inserted for the continuous bladder irrigation following a transurethral resection of prostate. In addition to balloon inflammation, the nurse is aware that the functions of the three lumen include. What are the functions are associated with three lumen, three-way catheter? When preparing continuous bladder irrigation, a three lumen catheter is ordered. Why? Because this continues the inflow and outflow of the urine solution. Question number 18. A triple lumen intervening urinary catheter is inserted for continuous bladder irrigation following a transurethral resection of prostate. In addition to balloon for inflation, the nurse is aware that the functions of the three lumen include The answer is continuous inflow and outflow of irrigation solution. When preparing a continuous bladder irrigation, a triple lumen indwelling urinary catheter is inserted. The three lumen provided for balloon inflation and continuous inflow and outflow for the irrigation solution. Then question number 19. Nurse Claudine is reviewing a client's fluid intake and output record. Fluid intake and urine output should be related to in which way? The answer is B. Fluid intake should be approximately equal to the urine output. If it is decreased, dehydration. If it is increased, the kidney is not functioning properly, you can find out. So the normally fluid intake is output is approximately equal to the urine output. Any other relationship signals an abnormality. For example, fluid intake that is double the urine output indicates fluid retention. Fluid intake that is half the urine output indicate dehydration. Normally, fluid intake is inversely proportional to the urine output. Question number 20. After trying to conceive for a year, a couple consult an infertility specialist. When obtaining a history from the husband, nurse Jenny inquires about childhood infectious diseases. Which childhood infectious disease most significantly affect male fertility? Is mumps. C. Mumps is the most significant childhood infectious disease affecting male fertility. Question number 21. A male client comes to the emergency department complaining of sudden onset of sharp, severe pain in the lumbar region, which radiates around the sides and towards the bladder. The client also reports nausea and vomiting and appears pale, diaphoretic, and anxious. The physician tentatively diagnosed renal calculi and orders flat abdominal X-rays. Renal calculi can form anywhere in the urinary tract. What is their most common formation site? The answer is A. A most common site of renal calculi formation is kidney. Calculi may travel down to the urinary tract with or without causing damage and may lodge anywhere along the tract or may stay within the kidney. The ureter, bladder, urethra are the less common sites of renal calculi formation. Question number 22. A female client with acute renal failure is undergoing dialysis for the first time. The nurse in charge monitors the client closely for dialysis equilibrium syndrome, the complication that is most common during the first few dialysis sessions. Typically, dialysis equilibrium syndrome causes confusion, a decreased level of consciousness, headache, and seizures. These findings, which may be lost several days, probably result from relatively excess of interstitial or intracellular solids caused by rapid solid removal from the blood. The resultant organ swelling interferes with the normal physiological functions. To prevent this syndrome, many dialysis centers keep first-time sessions short and use a reduced blood flow rate. Acute bone pain and confusion are associated with aluminum intoxication. Next question. Dr. Marcus prescribes norfloxacin 400 mg per oral twice daily for a client with a urinary tract infections. The client asks the nurse how long to continue taking the drug for an uncomplicated UTI. The usual duration of norfloxacin therapy is for uncomplicated UTI, norfloxacin therapy usually lasts for 7 to 10 days. Taking the drug for less than 7 days wouldn't eradicate such an infection. So, taking it more than 10 days is not necessary. Always doctor's advice is very important here. Nurse Joy is providing post-procedure care for a client who underwent percutaneous lithotripsy. In this procedure, an ultrasonic probe inserted through a nephrostomy tube into the renal pelvis generates ultra-high frequency sound waves to shatter renal calculi. The nurse should instruct the client should report the presence of foul smelling or cloudy urine unless contraindicated. The client should be instructed to drink large quantities of fluid. Each day should be flush the kidneys. Sand-like debris is normal due to the residual stone products. Hematuria is after lithotripsy is common. Next question, question number 25. A client is frustrated and embarrassed by urinary incontinence. Which of the following measures should nurse be include in a bladder retraining program? Answer is D. Assessing the present elimination pattern. The guidelines for initiating bladder retraining include assessing the client's intake patterns, voiding patterns, reason for each accidental voiding. Lowering the client's fluid intake won't reduce or prevent incontinence. The client should actually be encouraged to drink 1.5 liters to 2 liters of water per day. A voiding schedule should be established after assessment to prevent further urinary tract infections. So, these are about certain questions from urinary system. I hope you have understand the review and explanations from this urinary tract infections and urinary system review. If you like my videos, please subscribe and like this video. Thank you.